Good afternoon. I want to welcome and thank everyone for volunteering their time and joining me at this health conference today. For those who don't know me, I am Janeska Koyaso, a veteran with Doctors Without Borders MSF. I just returned from a project in Uganda where our team provided reproductive health consultations, assisted in deliveries, and offered obstetric repair surgery for women with vaginal fistula. When I'm not out on missions, I'm an obstetrician gynecologist over at North Texas Obstetrics and Gynecology Associates. Our office specializes in endometrial biopsy, colposcopies, LEEP electrical surgical procedures, infertility, prenatal care, and provide STD screenings, just to name a few. This afternoon, I would like to bring attention to one of the health concerns I saw out in the field: obstetric fistula. It is not prevalent here in the U.S. anymore, but it is highly predominant in sub-Saharan Africa and Asia. Over 1 million women suffer worldwide, and there are 50,000 to 100,000 new cases each year. And about 800 women die from pregnancy or childbirth-related complications around the world every day. In the 6 months I was in Uganda, we conducted a survey around the area, and of the 153 houses, 24 women were identified with fistula. And at my clinic, I handled at least 83 cases. Obstetric fistula is an abnormal opening between a woman's vagina and bladder and/or rectum. It typically arises from complications of childbirth, such as a very long obstructed labor, which can last for several days, but can arise from rarer cases, such as complications of unsafe abortions and surgical trauma. Symptoms include the inability to retain bowel movements, constant urinary incontinence, which can lead to skin infections and kidney disease, and individuals will often give a urine odor. In addition to the physical trauma, this condition also causes psychological issues. It affects the woman's self-esteem, which can lead to depression and isolation. Fistulas cannot heal on its own and require surgical repair. I typically check to see if wound care is necessary before performing the surgery, and afterwards I have the patients talk to our counselors for psychological rehabilitative sessions to help overcome depression and regain their self-confidence and self-esteem. After surgery, recovery time depends on different factors. One of the key factors that determines post-operative inpatient stay is how long a woman needs bladder catheterization, which is essential in the healing process. It can range from as little as 5 days to as long as 6 weeks, with an average being 2 weeks. I like to take the whole person concept into account, so I typically like to keep our patients for 4 to 5 weeks and have them go through rehabilitative treatment. I had a 19-year-old patient from a small village in Uganda that had never been to school. She stayed home doing chores around the hut to help her family survive. She was married at 14 and became pregnant a little after. She did not seek medical attention during her pregnancy, since the nearest clinic was a few dozen kilometers away and she had no transportation getting there, which is very common in these African regions. She was in labor for 3 days before seeking medical help. The village birth attendant tried local remedies and even made an incision in her vagina, but no luck. She was finally taken to a clinic where they performed a C-section, but it was too late. After her loss, she noticed she could not retain her bowel movements, was constantly wet, and gave off the smell of urine. She was embarrassed and ashamed. Soon after, her husband left, and the village outcasted her. She heard over a radio about the surgical repair we were doing at my clinic. When she arrived to the clinic I was at, it was not difficult to diagnose her with vaginal fistula. The signs were clear. I performed surgery and had her in recovery for 4 weeks, where she attended training workshops and received rehabilitative counseling. Obstetric fistula is both treatable and preventable. The most important step in preventing fistula is improving access to maternal and obstetric care. It can be avoided by delaying the age of first pregnancy, cessation of harmful traditional practices, timely access to obstetric care, preventing contraception, and education. While physicians are out in the field, we make sure to provide support to these women we meet. We need to educate them, their families, and the local volunteers and medical staff. We must address the stigma that surrounds this condition and stress the importance to seek medical care. Many men leave their wives, and these women are outcasted from their villages, not knowing where to go. It is our job to treat these women and help them cope. Challenges arise every day, from limited resources to dealing with old cultural practices. Some issues that still need to be solved is the stigma. Trying to get women to seek medical treatment during their pregnancy, during labor, and after. Trying to find funds for surgical treatment, educating the masses, and finding and providing rehabilitative services. Even with all these issues that still need addressing, I know the work here at MSF we are providing is making a difference. The procedure is life-changing for many of these women, and they are very grateful for the help. So please do not give up hope and help us bring more awareness. Thank you for your time.